Hi, my name is Georgia Timms, and I'm going to be telling you a little bit about my experience in health practicum and why it was my favorite class in all of high school. Starting off strong, everyone gets the opportunity to go shadow at Seton with your class. And if you're interested in the healthcare field, I definitely recommend this. I found it such a great learning experience, and I really enjoyed getting to see all the different working parts of the hospital. Each day, each class period, you'll transition to a different part of the hospital. These include mother-baby, NICU, pre-op, post-op. You also get to go see the x-ray tech and get to go into the lab and see all the different samples coming in, which was super interesting on like the sciencey side. When I was there, I got to see a colonoscopy. I got to go into the OR and see a jaw mother almost give birth, which was super amazing. When you're at Seton, I definitely recommend asking questions to the nurses, and even if you're on the shyer side, just trying to put yourself out there, just so it seems that you're engaged and that you really want to be there, because obviously at the hospital they're super busy, and so just making it worth the nurse's time and making it seem like you're super excited about it is going to be really helpful when you're there. After Seton, you have the opportunity to choose your own site. And when doing that, it can be kind of challenging because you have to go out to the sites. You have to call them or physically go to them and give them your information and hope that they'll let you shadow there. I would definitely recommend to reaching out to parents, friends, or just any adult that you know, even if they don't work in the healthcare field, because most likely someone you know will help you out with that, and can find you a connection to go visit. One of my parents' friends was able to connect me with a PA at a cardiology office, and I stayed there for about 2 months, which like hands-on or engaging as the hospital was. But I was able to build a stronger connection with the PA because it was just one-on-one with me and her. And this clinic focused on lipid management and disease prevention. And so I got to learn in depth on that subject, which was really awesome. And I got to go into different rooms with different patients and just hear the doctor-patient interaction. And I just got to ask a lot of questions, which was super cool, rather than the hospital where there's so many moving parts. So I recommend after the hospital to find maybe a clinic of some sort or something on a smaller level so you can get more intimate with the providers and ask more questions. I found that super helpful. Following my cardiology site, I went to a veterinary office, which Ms. Sumwell actually recommended because they obviously don't have any HIPAA laws because it's working with animals. So you're able to do a lot of hands-on activities. I was often able to pet the dogs, give treats to them, obviously. I helped trim their nails multiple times, trim their fur. I was also able to like hold lights for them and go into rooms with the patients. I also saw lots of cute puppies, which was a plus. The one downside was that it was definitely different from the hospital. It was a completely different experience. I noticed that they were a lot more relaxed, which I would expect, but it wasn't necessarily like the doctor-patient interaction that I was able to get from the previous place. So if you are going to go to a veterinarian, I would also recommend going to some sort of people doctor, which Seton could be that as well. Well, I definitely recommend just putting yourself out there in all of these situations. I think most of these people are super welcoming to have you observe, and most of them are super excited. But some of them are not, and that's just probably because they're super busy. So just being aware of those aspects and just being there to appreciate what they're doing and appreciating that they're taking time out of their day to help you out, I think is super important when just going into it. If I could have done anything differently this year, I think it would have been starting my search for a site earlier, because I went to CN, and then following that, I didn't have a site for a couple weeks, which I had to sit in class, which was obviously not as fun as interacting at a site. And it can be hard to find one, so I think just starting your search as soon as possible and reaching out to people so that you're able to get going right when you're done with your next one and you're able to start one again. Also, I would recommend going to multiple different sites to see where your interests are peaked and really just what you enjoyed most, because this is just about seeing if this is something you want to do in your future. But yeah, I had a great experience, and if I could do it again, I definitely would. So yeah, just make the most of it and have fun and just try to put yourself out there, I guess, is my biggest piece of advice for incoming students in this class.